Hello and welcome back to my attempt at my third video here for the Image Trend EPCR. We are going live tonight at midnight. You will no longer be able to practice on the site. It is go live, which means that when you create a report, an incident, it will be unable to be erased and it will be an official document. So hopefully you've had time to play with it. We're going to try to go a little farther in depth tonight, and hopefully we're going to be able to get you through this. And there will definitely be a learning curve, but don't worry, we're all pretty much in the same boat. I'm actually using one of the devices that will be in the squad. So this is right here what it's going to look like. The icon is what you're going to click. This is basically what it's going to look like, and here is how you will log in. Remember, it's your first initial, last name, and then whatever password you had set up. So you'll be able to continue. This is Elite Field, and you'll see there that it's syncing, and remember that you'll want to sync this when you have internet access. I currently do have internet access, so it's automatically syncing, but if you open up Elite Field without internet access, you won't be able to sync until you do have internet access, and that's what we're going to need you to do. So here is a list of the incidents that were done on this device by myself. This indicates that it has been posted. These are fake incidents, but all the incidents that you have entered will be left on here for a period of time. They will eventually fall off, and honestly, I can't remember what we set that time at. I believe it was a month or so. So those incidents that you've done already will be there. Hopefully these numbers will be at 100, which means that you've answered all the questions, all the required questions. But you can see that some of them have been posted, others have not been posted. If I wanted to post that, I could simply highlight that and post that, and it will save, and then it should post. But remember that when you post, you need to have internet access, which I do, but this process can take some time. So even if you're not at 100, you can post it. That way you can open it up on the Elite site and finish it somewhere on a different another device somewhere else. So that's posted. So we're going to go ahead and get into the incident. Remember, this stuff here on the left hand side, the crew and unit and shift, really do not pertain to our organization. You can add a crew in there, but I suggest you just totally ignore it, because you're going to be entering this information when we actually get into the incident. I'm going to open up a regular incident, a 911 response, and our options are basically all of those. If this was just going to be an assist form, you could click assist. It changes the information that you are required to enter. So we're doing a 911 response, and I'm actually going to skip through all of this, and I'm going to go down because we talked about all of that on the last video, and I'm not sure if I stopped at patient information, but I do want to, if I went over it, I want to go over it again, because you're going to want to hit find a repeat patient button. And there you can go in and you can enter in and search to see if this patient has been transported by our organization in the past. And obviously, just like any search engine, if you put in a name, it's going to bring up all those. Again, these are the fake runs that had been entered. These will be out of there. They should be out of there anyhow by the time midnight rolls around. So when you search for a patient, it will be a patient that has been transported from December 1st on, and that will reset every year. So if you pick up somebody in December of 2016, but you don't pick up someone until you pick them up again in, say, March of 2018, they will not be on there, even though you know you've taken them in prior. That will only last for a year. So go ahead and you can enter patient name and fill out all of this information. It's all required. I will point out when you get to the date of birth, it's really simple. If it's a June 6th birthday, you hit the June button, the 6th, and if they were born in, say, 1957, you can simply hit those. And when you click back on the screen, it automatically populates for you. This add patient to incident, if that would be used if you are transporting more than one patient. So if you happen to be transporting two patients from the same incident, from the same scene, you can click that and the incident information will open up and carry over into a new incident. Obviously, the patient information will be different. All your assessments and activities will be different, but all of these activities or all of these tabs that you've completed up to that point will carry over. So that's kind of a neat feature. So if you take two minor patients from a car accident, you're transporting them, and basically, you know, they're not too seriously injured. If you're transporting two of them, you can just click that add patient to incident, and you will be able to then enter or save your time from entering all the other information that you've already entered up here. Also note down here, no patient name is entered. When we get to the patient name, and we enter that information, notice how that automatically comes in here so you know which patient you're working with. So that's going to be important. That's probably going to be one of the first things when you start entering information. You're going to want to get the patient information in the back of the squad on the way to the hospital if you have the opportunity. When you start this, you're going to want to enter that probably rather quickly. That'll just help you when it comes time to sort out which patient, if you have multiple patients. I'm going to, we want to do incident disposition. And if we are actually transporting the patient, it's going to be patient treated and transported by this EMS unit. All of these turned red. That means that there's information in all of those tabs that is required. It looks like a lot of information, but again, you should be able to go through it rather quickly. And we're just going to pick up there and go through. And this was a single patient. Takes away out of that all that other information. If this was a single family home, that was defaulted. That one's done already. We go to patient condition. If we put down the timestamp when we arrived at the patient, was there a possible injury? We're going to say no, no cardiac arrest. They were oriented to person, place, and time, and they were unimpaired by drugs and alcohol, and they were above the age of 18. That one's done. Notice you do have to click into the next tab. It doesn't automatically go for you, but then from here, again, you're just filling out the information. How did the patient get moved to the ambulance? He was on a stretcher. We went non-emergent to the hospital. Position of the patient, a lot of times it's the semi-fowlers unless they're on a backboard or laying flat. How were they moved from the ambulance when you got to the hospital? They were still on the stretcher. You went to a hospital emergency department. That's defaulted, and this is all defaulted. This will be a not applicable unless it is a trauma. If you are flying them out or for transporting them to a trauma center, then you'd put that criteria, but this is not applicable. Destination information, we're simply putting in which hospital we're going to. That auto-populates your destination code. Reason for choosing, usually it's a patient choice. Final acuity, we're going to say he was green. and here's where you enter your mileage. So be sure to put in the decimal point, and it automatically then calculates for you, and you are then basically again done with that one. So we kind of went backwards. Patient information, we have to enter male or female. We do have to enter a race by picking one of those. If you're not sure, you can put other. And the rest has already been done. Then we go into demographics. If we had typed in back on one of the first tabs here on the dispatch information and incident address, if we started at the top, and let's say that we put this in, I'm making up this information, and remember 43527, I know that's the area code for Holgate. If I know the area code, I can put it in there, and then I click set from postal code, and it automatically does that. So now, if I've done that in that screen, when I get down to patient demographic here, and I can click same, if it's the same as the incident address, I click it, automatically populates. Here's a question you're going to have to, obviously you're going to know what our district is. Is this in district or out of district? The patient does live in the district. If he lives in Holgate, that is in the district. Closest relative, unless you have an underage juvenile, I would not worry about this. You can, if you want to put in that it was the spouse, that is an option. You can enter all that information in there if you would like. That is not required, but I would suggest that if you have a pediatric patient that you do enter all of that information in there. Now we get to the patient history. This can be somewhat challenging finding what their history is. So let's say that they have a history of hypertension, and let's say that they have a history of it lists all of these in here, and let's say they have a history of colon cancer. You can search all of those and enter. This is a multi-select, so whatever they tell you their medical or surgical history is, that's what you're going to want to put in there. And then you're just going to say that who told you. Was it the patient or a family member? If you're at a nursing home, was it the healthcare personnel? Somebody else or a bystander. In this case, we're going to say it was the patient. Here's where when did the symptoms happen, and let's say that, and we didn't fill that in, but we'll say that he was having chest pain and it started about an hour ago. We timestamp it. If we click on here, we can go over and let's say it started an hour ago, and then we can just simply put in subtract that hour. Were there advanced directives? A lot of times the answer is going to be no, unless you're going from the nursing home. If you have that, then you would fill that in. In this case, we'll say no. This is a required question. Is there any alcohol or drug use indicators? If there are none, then you would simply put none reported. Patient medications, this is where, all of the medications are listed. If they're on a medication, a prescription medication, and even many over-the-counter medications, it should be in here. If it's not, don't worry about it, but really good chance that it's going to be in there. Let's say that he said he had high blood pressure, so I'm not fortunately on high blood pressure medicine, but I thought there was a statin in there, one of the statins. Whatever their medicines are, you start in the search and find it, and you should be able to go ahead and list all of their meds. This, quite honestly, I have found is much simpler than writing them out, whether it was in the little space on the run form or writing under another, having to copy them. This is actually a lot quicker for me anyhow than writing them out. If they are on no medications, you simply put none reported. You also could see that there was, if they were unresponsive, we didn't know. If they happen to refuse to give them to you, that's probably not going to happen, but you have some choices there if you don't have the medicines or don't know the medicines. So we get into activities, and this is where we are going to enter all of our assessments. We're going to enter our procedures, our vital signs, any medication that we administer. If it's a controlled substance, there's a special section here and a special worksheet that has to be filled out for any controlled substance that is given. Now, I can also tell you that you can enter that information from the dynamic power tools on the side here. So if we click all, this shows you all the power tools. So let's say that we're going to do our assessment. And when we click that assessment power tool, we can pick what all of these are. Now, you may not actually do an assessment. So for instance, in this case, chest pain, there's a really good chance that there's no need to do really any of these lower assessments. So you can simply tag them as not done. You can go through and tag all of those, and I'm actually doing the click there. Then when you're done tagging, those are all, that means they were not done. So I clicked tag not done, and then I went and tagged them, and then I clicked done tagging. Let's say that you are checking some of these on the top row, and a lot of them are normal. Skin was normal. Mental status, normal. Face was normal. Pupils, normal. Shoulder, normal. Abdomen, normal. Pelvis, normal. Done tagging. So those are all normal. Now we go in to the neurological, and if it's normal, we can still click at normal from normal baseline for patient here. Or if they're having some problems, that's where we would document that. The other key part of this is, you notice up here in this corner, top right corner, it says details. This is what you can click on and write notes as to what actually be more specific. So let's say that neurologically he was having he has some left-sided weakness. Okay, he's got some deficit there. However, that deficit is from a prior stroke. You can go in there and in the details actually write in there that deficit and that weakness in the left side was from a prior stroke. Click OK, and now you've got that documented. Then when you are all done with that one, you click OK, and that adds that to the assessment. Let's say that you want to do another assessment. This is now going through, instead of the dynamic power tool, this is another way to add assessments. And you can do it, quite honestly, I think it's easier entering it through the dynamic power tools, but it's totally up to you. Again, here's where you would write the details. We said before that his skin was okay, but he's getting a little clammy now this time around. And if I wanted to put some details, I could put in there, seems to have an increased clamminess, I don't know if that's even a word. So whatever detail, specific detail you want to type in, you can obviously type that in. This is where I think this is going to really help us on our assessments. You know, a lot of times we're doing these assessments, but we're not documenting them. You know, we're just by looking at them, we're doing a face assessment. You know, just looking at the patient. And we noted that he had an abrasion on his, and then I would come in here on left cheek from prior fall. You know, the good news is when you're a horrible speller like me, you can you can correct it. Another great asset of this system. Then we could go in if we wanted to add another abdomen assessment or whatever assessment we want to do. It depends obviously on the nature of the call and what their complaints are, but when we're done, we simply click OK. That's all documented. Let's get into vitals, because I think that's going to be, you have to enter a vital. And there's a couple of ways to do it. We'll show you first through the on screen. You're going to click Add, and you're going to want to put the time, and you're going to want to put the actual time. This auto defaults to the time. It goes back to the initial time that you made contact with the patient. Obviously, if you are taking a vital sign and it's 5 or 10 minutes after the fact, you have to click in here, and let's say we're going to do subtract 5 minutes. Or actually, you'd be adding 5 minutes from the time that you had the initial contact. You will put in who did the procedure. If we had entered back in one of those first screens the crew, those would be listed first. You're going to have to answer this in every time you do a procedure or a vital sign. Was it obtained prior to EMS care, in this unit's care? And if you get on scene, first responders had vital signs, go ahead and enter that in. You can put the time that they got it, but when you get in here, when it asks you was it obtained prior to, make sure you say yes, because if you put in a time that was before patient contact, it's going to screw up your times, and you're going to be red like this is right up here. Level of responsiveness, I mean, you can fill all this in. It actually is pretty easy, and we'll just make these up, and you can tab through these and use the keyboard if you would like. You are going to have to do a effort, and let's say it was normal. And if you want to enter your systolic, he was a little hypertensive here. How did you perform it? It was an automated cuff. Pulse ox was, let's say, 95% on room air. That was his vital sign. Did we get a blood glucose? If we did, which we hopefully will, we'll enter that. And next one is we're going to enter his GCS, and he was all 4, 5, and 6 on that. And then the qualifier, it was legitimate values. It totals it for you down here. If we would take a temperature, we'd enter it here in the Fahrenheit, and it will convert it. So let's say we took it converts it to Celsius. No need to worry about that. The method was oral. And if you took a monitor strip, you would then, it would ask you to give a rhythm reading, and you have all those to pick from. Of course, if you didn't do something, the not button, whether you didn't it wasn't applicable, you didn't do it. Obviously, on a chest pain, you're gonna be doing one. You should be doing one on a chest pain, and I think probably let's go sinus. It was a sinus rhythm. And then you notice these lit up. So when we have a reading, it means how did we do it? And the medic did a 12 lead, and it was a manual interpretation. We really never want to put a computer interpretation. If you are a basic crew, you can always put transmission with no interpretation, because you're not going to be able to put a reading. You're not legally allowed to read a 12 lead. Here it asks for a stroke scale, and that's you can choose either Cincinnati, the fast, or any other type. I typically use the fast. We're going to say he had no fast. And that, again, those are things that you automatically can do simply by talking. You know, looking at them, no facial droop. You know, you've done this, but typically we wouldn't document this, which we should. So it's done. That vital sign is done. You click OK. No red, so you know that's a good vital sign. I want to get into, for the medics and advanced, when it comes time to do an IV. Notice in here on the activities, we would have to go to procedures. And when we get to the procedure, that's where we would be putting, we could do intravenous IV placement. Was it performed before? No. Who did it? It's going to have to be a medic or above. Size of equipment, used a 20 gauge. And he did it once, and it was successful. And the location was, let's say, the right forearm. And it always asks if there was a complication. If you type N for none, which hopefully normally that's what it will be, there was no complication. And then, just like it is on the paper form, was there any, what was the response? And we'll say it was unchanged. That simple, and hit OK. Now, obviously, that didn't say what kind of, if we pushed any medication. So since normal saline is a medication, we've got to go down here. I also want to note, this is kind of a neat feature. If we start at the top, obviously the time it was administered, no, it was not done prior to our arrival. It's going to ask for the crew member. Notice if I put in a basic EMT, like myself, it lists down here what medications I can do. These are the only medications that I can give by law. However, if I put a paramedic in there, like Mia, now that goes away and there's a bigger list. So all of the medications we carry are listed. And I don't really want her to pick that, but I wanted to show the list is fairly extensive and lists all of our medications that we carry, in which a paramedic can administer. If we do let's say it's not a paramedic, but it's an advanced, and I get down here to Donna Orthwine, that list changes again because that's a somewhat smaller list. It's a larger list than what a basic can give, but those are all the medications that an advanced can give. So getting back to this IV start, it was going to be a simple normal saline. And the dosage, you know, that this has got to be a number. And if you look in here and you click on that, it's going to give you why that's an error. And we have to document the dosage. And it's tough to document the dosage, but because we don't know how many, we don't know how much we're actually going to be doing. It's pretty simple if you just do KVO, or obviously you can pick, if it was liters, you know, whatever it was. I'm trying to see what may be the best. I'm thinking that we're going to want to leave that at KVO for a simple IV or an IV lock, saline lock. Then you necessarily wouldn't have to put in that much, but that is a pretty simple way of documenting it. And was there any complication? Again, it asks those questions, and we're going to say none. And then always have to hit OK there. I do want to go over here for an IV because that's kind of the one of the common things. In the dynamic power tool, again, you're going to have to list who it was that was doing it. We're going to say Daryl did it, what time he did it. Again, this is based on the time that we arrived at the patient, which is probably going to be different. So you're going to have to go in there and let's say we're going to add 10 minutes to it because we didn't do it right when we got to the patient. Used an 18 gauge. And here it just basically, in here it lists out all of these. If you click more, it gives you the rest of the possibilities. So if you'd start an IO in the humeral head, we're going to say did it in the left anticube. It was 1 attempt. And it was successful. And there was no complication. And what medication did we give? Again, since it was a paramedic, it's going to list, should list all of those. And we can, it does not list all of them. You would have to search for it. But we're doing normal saline here. And obviously you would have to put in the KVO, and it's probably going to ask, if we click OK, it's probably going to give us, it did not. So we didn't have to put there, we didn't have to enter an amount. So that's how you would enter any procedure. And let's just take a look at, let's go here and look at the procedures. This is all of the different procedures that you may do. Again, if there's one not listed, you can search for it. One of the more common ones is spinal immobilization as a procedure. Oxygen administration is a procedure. IO procedure, splinting, general splinting. If you put a vacuum splint on or a vacuum mattress, that's a procedure. Did you open the airway? All of these, anything that you do that would be considered a procedure is going to be, and again, you can search, if it's not listed here, you can search either by searching here or look for in the lettering in the alphabetical. The Heimlich maneuver, there's a lot of different procedures in there. So when you do something, any kind of procedure, this will take some time to document, but I think this allows you to document it very, very well and simple. At least I think it's a lot simpler than trying to remember to write all that stuff down. So we're going to say that this time we did open the airway. We didn't, obviously it doesn't make sense with our run, but it was successful. So you have to hit that. And the airway is not applicable on those. Get down here, was there any complication? And if you, like I said, you can do a search for none and it pops up. And you're always going to have to put a crew member. We're just going to pick somebody and then OK. Once you get back out there and you get back to this screen, the activity screen, it'll tell you if you've got if it is lit up, for instance, there, it's going to, and you can click on that. You're supposed to be able to click on that and it'll tell you. So you open that up and it's lit up. Was it? There we go. We always have to answer, was it performed before? And it does make us do a dosage. So you just enter all of that information in. The neat thing, if you don't do something and you click on it and you find that it will tell you what you need to do, and then always click OK. Controlled substance is a little different. So if you give a controlled substance, you can do this in the medications. So we're going to say that a paramedic did it, and the medication that they give was, we're going to say, some fentanyl. And it was dosage was 3. It sure helped them out a lot. Complications were none, fortunately. And we click OK. And if we go down to medication, there it is. It's not lit up, but notice how now controlled substance is lit up. And we're going to, now we have to fill out an extra, we need the tag number, the seal number off of the NARC box. We're going to enter that in there. And we're going to just click fentanyl. The amount taken out of the box, let's say, was 4 milligrams. We only gave 3 milligrams. That's how much we administered. How much was wasted? We needed to waste 1 milligram. And it says licensure. And now, so obviously that's not Daryl's signature. And then we go down here to the second person, and let's say it was Peter Brent. And then the very last box is what is the number when you... So that should have taken care of that. That's no red. But if we go to the worksheets, you'll notice controlled is lit up. There is a worksheet that we have to fill out. And this is not my doing. You can blame the State Pharmacy Board in the multiple forms of documentation. The other issue that we have with controlled substance is anytime a controlled substance is administered, the run report will have to be printed off, and the crew member that administered it, the medicine, will have to physically wet ink signature it, which means that signing on the computer is not good enough for the pharmacy board. We've got to print this out and then keep that on file. So our intention is we're only going to be printing off those run reports that are a controlled substance was administered. At some point then that has to be signed. And that can be later on, it can be a week later. At some point it needs to be signed. If the pharmacy board comes and does an audit, they'll want to see all of those forms and make sure that we have a wet signature on that form, which says that that person actually signed it, that administered it. This will also have to be filled out. You'll have to type in the patient's name, the amount used, if there was, and this is a waste. Was there any substance not used? If the answer is no, okay, then you can continue down and you still have to fill them in. You can either do 0 or not applicable. However, if there was some used, and I don't remember the name of our, I think Mike Adams was our patient's name on this one. I spelled that wrong. And the amount used was 3 milligrams. Was there any wasted? Yes. Amount wasted was 1 milligram. How and where? Down the drain at the hospital. Name and level of the provider that administered it. I am acting as Daryl, and he is a paramedic. This form, this worksheet, all has to be filled in, and here's where Daryl would then sign, and then his partner or the witness. If it is a nurse that witnessed it, sometimes the nurses will, sometimes they won't. Anybody, your partner anybody on the crew can witness it. Ideally, if you can get a nurse to do it, somebody not on the crew. But let's say the nurses were busy and didn't want to do it, so I did it. And I am an EMT. And then I can sign off there. And then again, drug bag number and squad, the controlled substance was taken. So let's say it was bag number 4, from the Malenta squad. And then whoever's filling this out, we'll say it was Daryl since he administered it. And again, then we go OK. And that should take care of any red controlled substance. If you have something lit in red, it means you've got to do it again. If we get down here to patient assessment, quite honestly, what I found, this could be one of the more difficult pages on the whole form. Primary symptoms may not be so bad because we're going to be doing chest pain. Was it just cardiac? Chest on breathing, we have to pick. We're going to say it was cardiac. That's probably the easy one. Other associated symptoms, if there were none, we'll say not applicable. Primary impression. So this is basically, it's not a diagnosis. It's not what we think the diagnosis is. It's our impression. However, I can tell you that all of these options are now are from ICD-10. If you know anything about medical billing and coding, you know ICD-10 was a big deal, and there are literally thousands and thousands, and they've narrowed it down for us. Quite honestly, you're going to have to find the one that fits the closest. You may not find the exact thing. This would be one. Could be angina, would be a good one. I think we had pain, and I'm bad at acute pain, not also angina, chest pain, other non-cardiac. Try to find one that fits. I have defaulted the provider's secondary impression. If you think that it's something different, so secondary impression would be is after the assessment, you come up, you think it might be something else. Your primary impression was angina. After talking with them, and you find out, let's say, I haven't really had any. I've had this chest pain off and on the last 2 weeks. The doctor says it's not cardiac. It's actually reflux. That you could go in and then say, okay, and I no longer think it's angina. And if we put in there pain, and then we could change it to non-cardiac. That's what that second impression. Don't have to have that in for the state reporting. It's not required. And that, quite honestly, is why I'm just going to put something in there so it doesn't light up red. So that's what that's about. That will be defaulted to not applicable. You could obviously do not applicable there. Initial patient acuity. What do we think this is? Is it big? Is it bad? Is it not so bad? Well, we turn out we don't think it's so bad. And possible injury, no, that was answered before. If it was an injury, we could go here to injury information and answer these. We do not have to, since there was no injury. We can skip that. Patient complaints. His chief complaint, we got called for chest pain. And this is where you actually get to type in what they think it is. How long? It's been happening for about an hour. And we can pick that if it was been for 1 day, 1 minute, 1 month. Been going on for a year. They decided to call 911 at 3 in the morning because he's been having chest pain for a year, but now he wants to go to the hospital. That happens. Click OK there. Barriers to care. There were none. You can see if there were some other issues, large people, physically impaired, if there was something that was a barrier for us. The anatomical location, and this is easy. It's going to be chest. The organ, quite honestly, we're not sure. It could be musculoskeletal if we don't think it was cardiac related, but we think it's cardiac related, so we're going to click that. Notice we get down here, we've got our narrative, And actually, before I do that, I'm going to go back and quickly fill out these tabs up here. And it was paged out as chest pain. And we didn't know in our chest pain, non-traumatic. All of these other ones are already set. Unit information, I'll review for you quickly. Remember, this is listed in there. This is the year it was purchased and which one. So if this is a Melinta run, Melinta is 10-02 and Melinta EMS. And the primary role, ALS ground. The level of care basically depends on, is this going to be ALS or BLS? We started an IV, so it's an ALS, and we had a paramedic. Response information, was they the first on the scene? Yes. Was there someone else on the scene? Medic 2 may have been on the scene. We typed that in there. And the type of service, Medic 2, is we can put ALS intercept. Quite honestly, there's all your choices. Most of them all are going to be mutual aid, EMS mutual aid. And EMS mutual aid in this case has nothing to do with whether it's in district, out of district, or whether it's, you're getting called as secondary squad, or you're getting called as a primary squad to a different location or different area than you normally cover. And then you have to click OK. Crew information, this is where you're going to enter. If you do this in the beginning, it does make things a little easier at the end or throughout. It's going to default, and remember we have to put the role, and he was the primary at the scene and on the transport. And then we go to, we have to go to add. You don't have to click OK on that. Just click add to add the next person. I'm going to put Pete Brent. And Pete, let's say, he drove for the transport. He could also have been an other patient caregiver at the scene. He helped take vitals. So you're going to list all of their roles. We're going to add one more. I'm going to put myself on the call here. I happen to be around and made this call. And I was a other patient caregiver at the scene and other at the transport. If you have someone that showed up at the scene but did not go on the transport, you notice non-transport scene support. So you can put them down that they were there. So let's say that we're going to add somebody that was there but couldn't go on the run. Let's just say Rosa was there, but Rosa couldn't go on the run, but she was there to help. That's where we would then go non-transport scene support. That means she did not go on the transport. And that's all we're going to list for those that don't go on the transport. And that, quite honestly, is a way that we will calculate payroll. So if they didn't go on the transport, but they were there, you can document that they were there, but be sure to put that they were non-transport. Response times. To list these, to put them in there, it can be difficult, and it's going to be a problem now because when we filled in arrived at the patient time, if I just start time stamping, notice how these are all going to light up because the times are going to be all screwed up. You can't have a time of call at 1947 and arrived at the patient at 1907. So we're just going to get the some of the red marks to go away. We're going to try to go through these and make it 18. And if we try to do this, you can go ahead and type in there if you want to. That sometimes is easier. And so that should be good because maybe we were at the scene for 41 minutes. Hopefully not, but so we should be able to timestamp these now, and we shouldn't have any red. So notice no red. Also notice down here, very important, the 93, the validation. We're at 93 points to 100. We're getting awfully darn close to having this run report done. We get into the narrative. The narrative can be fairly simple. If you notice up here in the corner, generate, this will auto-generate. There's 4 different types of notes that you can do: a SOAP note, a medical abstract, a chart D, and a sequential. And quite honestly, I looked through them to see what it looks like. The chart D lists everything that you did. If you didn't do all of these assessments, we tag them as not done. It documents it. If we go to the SOAP note, it will give us a little different information. And we're going to overwrite that. And this is where then you can simply start typing in. Called for report of chest pain. The patients, we found the patient. Here's where I would put where we found the patient and what they looked like. And also we note that claimingness is spelled wrong. So do not think that by this auto-generate narrative means that it is a complete narrative. You are still going to have to add information in there. It's not going to put all that information in there. You still need to come in here and add a lot of specifics. But I can tell you, it makes your narrative go a lot quicker. Okay? So this in itself, by leaving this narrative like it is not acceptable. This would not make it through your QA process. You're going to get this back and say, hey, this really doesn't tell me everything you did. It doesn't tell you what the patient said. Then, it doesn't say where you found the patient. Doesn't say, it doesn't give any of their prior history other than listing it down here. So I guess it is when it says noted below. That will when it prints out, it will be listed there. So I guess you're covered there. But don't get into a bad habit of just using this auto-generate as your narrative. Go in there and clean it up and make sure that you have definitely all of the information that you need. For the time's sake, we're going to say that this narrative is complete, although, as I said, it's not complete. We're going to move on to the signatures. We're going to add a signature. Remember, we still need to get patient signatures, and when we do that, in this case, it's going to be patient. The reason is always going to be, if we're transporting, is HIPAA acknowledgement release. When I click that, and we go down here, we're going to timestamp the date, the crew member that got it. I asked them to do it. Get patient name. You want to put in the person who's signing here. Not my name, not your name, unless you're signing as a crew member, which we'll get to next. In the status, we always have to put, assuming that you get it signed, we have to put signed. Let's say that it's not signed. You fill it out and then put why it wasn't signed. Okay? They refused, they were unconscious, whatever. Signed means that it's been complete, and you will then, they're more than welcome to read through our privacy policy, and then release of billing information is the last big paragraph, and it gets down to the bottom. Scroll all the way to the bottom form, and this is the patient, and you just have them sign, and you can flip the computer over and make it a tablet and put it in front of them just like a clipboard. When you're done, click OK, and that's done. The last signature that's needed is the primary care provider for the event. Not everybody on the run has to sign this, and that's a change. Obviously, in the past, everybody that was on the run had to sign the run report, or you didn't get paid, or you were asked to come in and sign the run report when it was done. Right now with this, we're only requiring the primary provider sign here. And this is going to be an EMS provider. It's going to ask for timestamp when you signed it, the crew member, and let's say it's going to be Daryl. Again, not going to use patient name. We're going to leave Daryl's name because that's who's signing it. And we're going to say that it is signed to make that red go away. Notice how we got to 100%. And then we're going to have Daryl sign. Looks nothing like his signature, I hope. And click OK. Notice we're at 100%. It doesn't mean that you have a perfect run report. It means that you have answered all the questions required for state reporting. And it does mean that you have a very good chance that you're going to pass the QA and that you have a very good run report. This needs to be at 100 and you should be good. When you have completed your run report and you're all done with it, in the status, you are going to move it to ready for QA. I want to go through this, and this is we'll finish with this, but ready for QA means that it'll be QA'd and it'll be automatically dropped to the state reporting, and after it's QA'd, it will automatically be dropped to the billing. If it needs crew attention, you'll get an email saying run whatever needs some attention. You know, you didn't do this, or you didn't document. Why didn't you follow protocol? Why didn't you do a 12 lead? Didn't do a 12 lead because you know, we were an all basic crew and had no means of transmitting the 12 lead. So or you were an all basic crew, why you didn't document why you did a 12 lead. You're not supposed to do a 12 lead. So normally for you, it's going to start in progress, and then it's going to go to QA, say ready for QA, and then you are done with this. And most importantly, if you haven't done it already, if you did the whole run report on the same device at the hospital or in the squad before you go home, either way, you're going to have to post. And that will take a few seconds. Remember, you do at this point have to have internet connection to post it. And basically, when that posts, you let it go through, and you are going to be all done with this run report. You can then close it up, put it away, and go home. When it tells you it was posted successfully, you are then done, can close it, and then you can close right out of that, shut her up, and go home. So I know this was another long video. I truly hope that wish you the best of luck. It's kind of go live time. Anything after midnight on Wednesday here is you're going to have to complete this with the computer. So good luck. And if you've got any problems, don't hesitate to give me a call or text me or whatever means you can to get a hold of me or somebody that can help you through this transition. So I really appreciate it, and thanks for watching.